Hello, my name is Andrew Cage, and I'm the head athletic trainer here at UT Tyler. Thank you for coming back to UT Tyler if you're a returning athlete, or welcome here if you're an incoming athlete. I'm here to talk to you guys today about the sports medicine portion of your orientation. So the first thing I always talk to new athletes about is what is an athletic trainer, whether you're at a high school, a junior college, another four-year university. Sometimes you're not exactly sure what the role of the athletic trainer is because either you didn't have an athletic trainer or they didn't really clearly define that role for you. So what an athletic trainer is a board-certified healthcare professional who practices sports medicine. What that means is that when you have an athletic trainer at your practice or at your game, you have a highly skilled athletic trainer that specializes in injury prevention, injury diagnosis, and injury treatment. Simply put, your athletic trainer's there to make sure you're staying on that field happy and healthy and making sure that you're able to play to the best of your ability. We're not there to take you off the field. We're there to keep you on the field as comfortably as possible. First thing I always like to go over with athletes, even if it's just a refresher, is to talk about the rules of the athletic training room. We'll start with the things that we don't want you guys doing. First one, we don't want food or drink in the athletic training clinic. It's a healthcare facility. There may be people with open wounds, things like that, and we don't need to be contaminating it with food or drink from the outside. Secondly, we don't allow our cell phones in the athletic training room. Cell phones a lot of times can be used to take pictures, and that can be a violation of other people's rights if they're receiving treatment or being evaluated for injuries. We also don't like loud and obscene language in the athletic training room. A lot of times you're going to figure out quickly that it gets crowded, and if we all try to talk over one another, it makes it a lot harder for us to hear one another, especially if we're trying to take care of somebody's health. And then also, self-diagnosis is not going to be the way to go. If you come in and you've already been on WebMD or Googling your symptoms, a lot of times that's not necessarily an issue, but at the same time, let's wait until we have a chance to go through this whole process, figure out what's going on with your injury, and then we can make a game plan together from there. We also don't allow self-prescription of therapy. You don't come into the athletic training room and say, this is what I need. You come into the athletic training room saying, this is how I'm feeling. What can we do to make me better? On the other side of things, we do want to make sure that you report any injuries or issues that you have. Like I said before, we're not trying to keep you off the field. We're just trying to keep you comfortable. And whenever you guys come into the athletic training room and you come in and you get care, it's going to be a situation where we can help you be a lot more comfortable as you're trying to compete to the best of your ability. We also want to make sure that you're using absolute honesty with us. Whenever you come in and we're discussing injuries or anything you've had happen to you in the past with other medical conditions, the more information we have, the better we can help you out. And if we can help you out better, the chances are that you're going to be a lot healthier when you're on the field. We also want to make sure that you report during a lot of rehabilitation time. If we set time aside during the day whenever we want you to come in and get treatment and get better, we want to make sure that you're committed just like we are to making sure that you're staying on the field. Also, we want to make sure that you're treating the entire athletic training staff, whether it's full-time professionals or our student workers that you're going to see in the athletic training room, with respect that you would show any other healthcare professional. Good rule of thumb is going to be, if I wouldn't do it in a doctor's office, I probably shouldn't do it in the athletic training clinic. So now, let's talk about what you have to do to participate. The first thing is going to be that you have to complete all of your sportswear paperwork online. This paperwork is going to be made available on the sportswear website, and your coaches will be disseminating instruction sheets to show you how to log on to that website and where you need to go to fill these paperwork out. We also need to make sure we have a copy of your active insurance card, and we need to make sure that that insurance covers athletic injuries. Additionally, you're going to have to go through concussion education, which we're going to do here in a little while, and then there will be an acknowledgement form you have to sign as well. You also have to go through sickle cell trait education. Whether or not you've been tested for sickle cell trait or not, you do have to go through at least one section. And we also make sure that we screen you guys for concussions. This is going to take place a lot of times either before or right during your physicals, but it is something that has to take place before you start to compete in your sport. And lastly, you're going to need to make sure that you get a UT Tyler physical. This is going to take place either the first day of school or the day before you start up if you're a fall sport. And in order to sit for one of these physicals, you have to make sure that you meet those deadlines that your coaches are going to make you aware of for your sportswear paperwork. So, like we said, there's going to be a piece of education about concussions. So, whenever we talk about a concussion, it's important to understand what it is. A lot of times a concussion is going to be something that's going to be a traumatic brain injury. This can occur from either direct trauma or a whiplash type mechanism, thinking like a car accident or something along those lines. And we've seen different movies that have come out. We've seen SportsCenter stories, all these different things telling us why concussions are an issue. And one of those main reasons is that this can result in motor and cognitive function because, simply put, you have injured your brain. If you injure your hamstring, you're not going to be able to run as well. You injure your brain, you're not going to be able to think and coordinate movements as well. And even if we go past these effects right here, you can run into a situation where you can have long-term issues. And it doesn't necessarily stop at motor and cognitive function. A lot of times it can even lead to death. And another thing that we always need to make sure that you understand is that there is going to be no such thing as a minor or a slight concussion. We treat any type of concussion the exact same as we would any other concussion. And it's going to be a situation where the severity is always going to be high because you're only going to have one brain to injure. Now, as you're on the field, if you sustain a blow to the head, you're involved in a collision to where you think you may have a concussion, it's important to know what symptoms we're dealing with. The first and most obvious one that people talk about is going to be a throbbing, pounding headache. You might also begin to experience dizziness or lightheadedness. As time goes on, you might experience nausea that can lead to vomiting. You may start to have amnesia where you can't remember things right after the hit or things that happened earlier that day or even earlier that week, depending on how bad the concussion is and what part of your brain it's affecting. You also may result in blurred or double vision, ringing ears, and a lot of times people with concussions say that they feel off and just don't feel like they're themselves. And so these are all going to be symptoms you need to look out for if you sustain a concussion or if you even just have a blow to the head. These are things you need to make sure you're aware of. Now, treatment for concussions. The only treatment for a concussion is going to be complete and absolute rest. You cannot speed up concussion recovery regardless of what you might see, people talking about fish oils, acupuncture, different things along those lines. Those cannot speed up concussion recovery. They can relieve symptoms, but they're not going to make your brain heal any faster than your brain can heal at its pace. You can, however, slow down concussion recovery. So in order to keep from slowing down your recovery, you need to start to try to avoid things that tax your brain. In today's society, that can get a lot harder because when we look at these things, we're talking about texting, computer usage, talking on the phone. Sometimes it can even lead to something along the lines of doing classwork or going to class itself. And those are things that we need to make sure that we discuss if you end up being diagnosed with a concussion. And then it's important to note that return to participation, you must be cleared by a UT Tyler physician. Now, this basically is trying to keep you guys from trying to get back too quickly or trying to go and seek outside care. We have sports medicine trained physicians that are here for you and are here to make sure that we return you to play as happy and healthy as possible. So your evaluation will take place a lot of times on campus if you have a concussion, and then we'll be able to start the process from there. So this is, again, one of those things that we cannot stress enough. If you have a concussion or you think you have a concussion, you need to report it. It may be a situation where you end up getting cleared and we just say, no, you just have a bruise on your head because you got hit in the head. But at the same time, this can be something that can cause you to miss a lot of time or a little bit of time, depending on how honest you are with your symptoms. Remember, we always talk about this. You only have one brain and you need to treat it well. A lot of times we talk about the Division III model where not everybody's going to go pro in sports, but you're going to go pro in something else. Well, whatever you guys are choosing to pursue as a field, you're going to need your brain intact. Another thing to note is that you don't just have a responsibility to yourself, you have a responsibility to your teammates. If you have a teammate that you suspect may have a concussion, you need to tell your athletic trainer immediately. Because if they're not willing to talk, they're being stubborn, you may be the person that ends up saving their life if you help us get them out of that game. So whenever we go back over concussions, you're going to have paperwork that your coaches are going to help us disseminate to you that you're going to have to sign acknowledging that, yes, I went through concussion education. Same thing is going to happen with sickle cell trait. Sickle cell trait is going to be a hereditary condition that's going to affect the red blood cells in your body. And whenever this occurs, your sickle cell trait can cause your blood cells to sickle. And as it's doing this, it can lead to decrease in oxygen to your vital organs. It can cause blood clots. It can lead to loss of consciousness if that decrease in oxygen persists for too long. And ultimately, it can result in death. Now, having sickle cell trait does not mean that your blood cells are sickling 24/7. It means that they have the potential to sickle if they are put into an environment to where they have a predisposition to do so. So we always like to tell people that it's a recommendation of the UT Tyler sports medicine staff that all of our student athletes undergo sickle cell trait testing to determine their status, whether it be positive or negative. That being said, a lot of times people don't have the time or the resources to get this done. So if you choose to forego this testing, then you have to go through 2 rounds of education regarding this condition. This talk we're having right here, right now, is going to count as one of your education sessions, and then there's going to be a video that's distributed to your coaches or through Coach Stephanie Webb that's going to be serving as your second round of sickle cell trait education. So a lot of times whenever we're talking about conditions and illnesses, people want to know about how do you get it? How do I catch it? Is it contagious? Sickle cell trait is absolutely not contagious. Like I said, this is a hereditary disease, and the only way that you can obtain it is to be born with it because of the genetics that your parents pass on to you. And it's also important to know that sickling can occur at any time. You can be sitting completely at rest and suffer a sickle cell event. However, there are going to be risk factors that make you more predisposed to having an issue. The first one's going to be altitude. So this is going to be a situation whenever you're playing at an area that's well above sea level, you have decreased oxygen at that level. So your body's already going to be predisposed to not being able to handle the change and the stresses. And now you're having that thrown on top of your sickle cell trait condition you already have. Heat can also be a predisposing factor, as well as other illnesses. So if you have a cold, a stomach virus, things like that, that may predispose you to sickle if you're doing physical activity. Also asthma. Asthma is going to be another medical condition that can lead to decrease in oxygen to the body, and so that can exacerbate or even trigger a sickle cell event. So as you go through this, whether or not you know you're diagnosed positive for sickle cell trait or not, it's important to know what the signs and symptoms of a sickle cell trait attack are. So the first one that you're going to notice is going to be abnormal fatigue. This isn't going to be you just got done running 6 miles and you're tired. This is going to be I'm a distance runner or I'm a distance endurance athlete that has gone through training for years and years and years. I'm a college athlete and I just got done running my couple of warm-up laps and I'm already gassed and exhausted. That should be a quick warning sign that's letting you know you're not recovering as fast as you need to, and that fatigue is lasting longer than you think it should. That's going to be something that should start to trigger a few warning signs in your head. Another thing is just going to be feeling ill. If you're feeling ill, first off, you should be talking to the athletic trainers in the first place. However, if you know that you have sickle cell trait, it becomes even more of an emphasis for us to make sure that we know what's going on. Another big one, if the sickle cell trait attack is starting to occur and it's been going on for a while, is going to be the sensation of muscle cramps without having muscle spasm. So you may feel your calves starting to cramp up, but then whenever you look down, the muscles are still relaxed and loose, and you're not really cramping, you just feel that way. That's going to be another sign that this sickling is starting to occur and that you need to let your athletic trainers know what's going on right away. So, once again, we do recommend that you get tested, and if you have been tested and you are positive, it's your responsibility to make sure that the sports medicine staff knows about your status. It's not going to be a situation where we hold you out of a game. It's just going to be a situation where we know what's going on with you and we can better care for you. Again, if you have or have not been tested, you still need to know that if you feel these symptoms, you need to let the sports medicine staff know immediately. It may be a situation that's as simple as us just having a conversation with you to rule out a sickle cell trait attack, or it may be a situation where we end up saving you from a medical emergency. So that's everything that we have right now. Like I said, there's going to be an instruction sheet sent out to you regarding your paperwork in terms of doing your sportswear online medical documentation. Whenever you start to get your insurance cards, you can either have them sent to me, Andrew Cage, here at the Athletic Training Room, or you can have them sent to your coach, and your coach can make sure that it gets back to us as well. Thank you, and enjoy the rest of your orientation.